Nigeria has received 10 million vaccines against COVID-19 so far since the inception of vaccination. Executive Director, National Primary Healthcare Development Agency, Dr. Faisal Shuaib made the declaration while unveiling the 501,600 vaccines donated by France government to Nigeria. Dr. Faisal Shuaib said the Nigerian government will continue to administer the vaccine so as to meet the 40% target of the total population by December.
It is really with profound appreciation to the government and people of France that I inform you that we have taken delivery of 501,600 doses of the AstraZeneca COVID-19 vaccine donated by the government of France to Nigeria through the COVAX facility. These vaccines were received in Nigeria on Monday, the 4th of October, 2021. It is indeed gratifying to say that France has not only been a dependable developmental ally to Nigeria, but has been quite broadly in all ramifications. The donation of over 500,000 doses of AstraZeneca to Nigeria is a demonstration of France's confidence in Nigeria's ability to work not only as a partner, but also a very critical ally when it comes to the global fight against the COVID-19 pandemic.
He also said the United Kingdom has approved the certification program on vaccination from Nigeria.
Excited about the fact that the UK government yesterday released a statement clearly stating that as from the 11th of October, any Nigerian who has had evidence of vaccination that 14 days prior to the arrival to the United Kingdom will no longer have to isolate for 10 days. Right? So what it means is that our vaccination certification program has been approved by the United Kingdom. One thing that the Presidential Steering Committee, the Federal Ministry of Health and NPHCDA recently communicated is that the United Kingdom is going through these reviews of vaccination certification program cases. They have finally, through engagement, been able to assess our vaccination certification program and have and convinced that we have in place a robust enough system that will clearly be able to identify those who have taken the vaccines and those who are yet to take the vaccine. We have a database that clearly states the name, the batch number, and some unique identifiers for everybody who has taken the vaccine. So it is on account of this that the UK government approved that our vaccination certificate system is good enough to allow people to arrive the United Kingdom without isolating for 10 days, as was the case a few months ago.
France ambassador to Nigeria, Jerome Pasquier, while handing over the vaccine to the Nigeria government, said the gesture is out of goodwill and France supports to end the spread of COVID-19 in Africa, especially Nigeria.
Which is a donation by the French government through COVAX of 500,000 doses of AstraZeneca vaccine, 500,000 doses, which is a very significant quantity of vaccine for Nigeria. And AstraZeneca, which is a very good vaccine, this is the one I was vaccinated with, and you see I'm in very good health. So you can use it really in complete trust. We are very much aware, my president is very much aware of the necessity to make vaccine available to everyone all over the world. For the time being, there have been a big discrepancy between vaccination in the northern countries and vaccination in countries like Africa. Of course, in Africa, you have been dealing very well with the pandemic. If you remember what was said 2 years ago, 18 months ago, everybody was announcing a big catastrophe in Africa, and it didn't happen. It didn't happen because you reacted very well, because you have a very good system, and I think we can really praise you for the action of the President Task Force, for the action of all the institutes involved, and of course of NPHCDA too. For the time being, the number of deaths in Nigeria from COVID is, well, always too high, but reasonably low if you compare with countries, even with my country. But we know that this is not enough, and on the long term, vaccination is essential if you want to be completely rid of this awful disease. And this is why we're happy to contribute today to this program of vaccination here in Nigeria, which is going pretty well, I understand, but it needs to be developed. And really, I can only join what has been said about encouraging everyone here to be vaccinated. I have to say also that I am especially pleased to be here today on a more personal note, because as some of you know, this is in fact my last day in Nigeria. I have been in this country for 3 years, and I shall leave tomorrow for Paris. And I'm very happy that my last official event is this testimony of solidarity of France with Nigeria on a very important issue.
Country Rep WHO Dr. Walter Mulombo, as well as that of UNICEF, United Nations, is concerned about transfer of technology to Nigeria so as to encourage local production of the vaccine.
For countries that are lagging behind, as you know, WHO is engaged with the manufacturers to try and negotiate technology transfer and build capacity for local production of vaccine in some places. It's already happening. WHO reached out to G7, the G20, to secure the commitment to share the doses, and the effort we are acknowledging today is part of that advocacy, and we will continue to advocate for a fair distribution of vaccine across the world. You know that in some countries they are talking about the booster dose, etc., which may delay availability of vaccine in other countries, and WHO has come out and with the moratorium to withhold the booster dose to enable other countries to reach at least the coverage that it is set up, so that we have a fair number of people vaccinated and hopefully achieve herd immunity and get out of the acute phase of the pandemic.
In this effort, the government of France has supported these AstraZeneca vaccines, and we thank you for that. I hope in the coming days also we will be working together to reach to more population with the vaccinations.
Gilbert Da Amadi, Voice TV, Nigeria.